Well, hello there. It's good to see you on this beautiful Sunday right here on Health Diary. My name is Winnie Lubembe, and we're coming to you from Malaika. Now, listen to this. There's this notion about once cesarean section, always cesarean section. But did you know that over 70% of women who say give birth to their first baby through cesarean section, over 70% of them could actually try vaginal birth, and it is successful? How is that even possible? Well, we'll find out after this fact of the matter.
Vaginal birth after cesarean section, or VBirth, refers to vaginal delivery following a previous cesarean delivery. It is a generally safe practice associated with a 60 to 80% success rate, meaning 3 to 4 out of 5 women who have previously undergone cesarean birth can successfully give birth vaginally. However, it carries potential risks including uterine rupture, which may result in maternal and neonatal complications.
My name is Mary Mukonyo. I'm a mother of 5. I got pregnant in 2007. I tried having a normal VBirth, but unfortunately, I did not dilate past 4 centimeters. I was taken to theater for CS. After that, I attempted my second again. The doctor said it was okay to actually try a normal delivery. Unfortunately, again, I did not go past 4 centimeters. They could not even explain why. I think it's just nature. Even after being induced, still nothing. So I had to go to theater again. After that, due to a few reasons here and there, medical reasons, I could not attempt a third VBirth, so it had to be CS also. They said there'll be a risk of the uterus rupturing or the opening when you're pushing during contraction. So that would be a very high risk. So they really discouraged that after my second C-section. From my personal experience, you'd rather go VBirth. There are so many challenges that come with C-section, like constant backaches, you can't stand for long, you can't walk for long, you can't sit for long. Headaches as well after the C-section. And then milk production also is affected by, personally, mine was affected. I would have preferred a normal birth. The healing process is so quick. You get to enjoy the first month with your baby. With a C-section, most of the time your baby is carried by somebody else because you cannot sit for long.
Well, that was Mary sharing a bit of her story as far as vaginal birth versus C-section and what forced her, quote unquote, right, to go for C-section. But now we have Dr. Lisa Ochola, who's an obstetrician gynecologist right here at Malaika, now to give us more details in terms of what exactly is VBirth and why is it such an important conversation. And Doc, thank you so much for making the time. Busy day.
Yeah, very busy day, but thank you so much, Winnie, for being patient and also for this opportunity to discuss
Talk about this important conversation.
Yes.
Now, you see, most of the time we've had this notion that once C-section, always C-section. But this is not always the case, right?
Yeah, that's
Why is this
true.
such an important conversation to even think about?
So I think before that myth has always been there. Once a C-section, always a C-section. And fair enough, we're not demonizing C-sections and saying that they are terrible and, women should not do them, or you're not a mother if you've undergone a C-section. You still are, it's still valid. But the truth of the matter is C-sections do carry a lot of risk when they are done. Just the fact that you're in surgery, you still have the surgical risks, you still have the anesthesia risks as well. And it is actually scientifically possible to deliver vaginally after having a cesarean section if the conditions are right. So that's why it's an important conversation that we don't just lock in women and say once you've done a C-section then you're condemned to always have to carry that risk from then onwards,
Yeah.
there is the possibility of delivering vaginally if the conditions are right. So it's important information to have now that we are also empowering ourselves, especially as women with just about your health, especially your reproductive health. I think it's very important.
Yeah, and also advocating for yourself.
100%.
Okay. Can we first of all understand, so C-section, because we know there are different types that is done.
Yeah.
This is me now.
Yes, exactly.
And now thinking about vaginal birth after C-section, there's so many factors that need to be considered, right? Can we start from there?
Yes.
Yeah.
So, as you said, vaginal birth after cesarean section, basically it is after you've had a CS, you can attempt one. First of all, the timing has to be right. So let's say from the time that you delivered the first baby, even if it was C-section, to the time that you're attempting this should be at the very least 2 years difference.
Okay.
So not that you conceive after 3 months and then now you're attempting then, because the scar is very fresh. And just to always keep at the back of our minds, the uterus now has a scar. And scar tissue is very different and it will always be there. It is usually weaker, it is usually more susceptible to tearing, especially when you contract or you grow bigger and you go through the birth. So that's always to be kept at the back of our minds.
Okay.
We usually try, just so you've only had one cesarean section, that's what we usually can try. It's true abroad they do have that attempt of 2, but the risks are even more. Okay. And then we say, as long as this lady did not have a cesarean section for reasons like they had what we call, it's not a small pelvis, we'd say, like there's just a disproportion with the pelvis and the baby's size.
Okay.
And so her pelvis was not adequate, so meaning the baby just couldn't really pass through. And so that's one thing that you'll be like, it could likely happen again, so that's contraindicated. But if, for example, it was just because the baby's heartbeat was not, you know, good at the time of the first cesarean section, but everything else was fine, she can definitely attempt.
Yeah.
If she reaches 36 weeks and the baby's head is facing down and she's now nearing term, so she's about 37 weeks, she can also attempt to try and push the baby. If the baby is not too big, so not above 4.5 or 4 kilograms, again, that's also something. So if everything basically has gone well during her pregnancy and these conditions are there, and the indications for the last cesarean section is not to do with her pelvis, it was not a cesarean section that was done, you know, during preterm, because now below 34 weeks, there's a way that we cut the uterus. If you cut it along as opposed to across. So if you cut it along because of this, because the baby is small, or you even had fibroids and you underwent major surgery, then those are now contraindications to you attempting a vaginal birth after cesarean section. Okay. Now that's the reason you go to clinic and discuss this with your doctor, who will be able to, you know, just evaluate and see if you're actually a candidate for it. Yes.
Oh, interesting.
Yeah.
And then there's some people who would say, listen, so maybe the first pregnancy was because maybe I was scared. So a lot of people would choose to go for C-section as compared to giving birth vaginally. Yeah. And then maybe the second pregnancy, they're like, okay, maybe we can try. Yeah. Are they a candidate or not?
They are, as long as those conditions are there. So as long as they've reached term, so above 37 weeks, as long as the baby's head is facing down, as long as the ultrasound scans show the baby's not too big, and there are no other issues surrounding, like the mom doesn't have heart disease or the baby doesn't have whatever issues, they can definitely attempt it. Okay. For as long as they have had one cesarean section scar. In some countries, they can even attempt 2.
Okay.
Yeah.
So what are these existing risks that people should know about? And then we'll then focus on how soon should you start having these conversations.
Right.
You know, because there's a lot of conversation around it. Oh, where do you want to give birth? Like, who is your obs guardian? All those things.
Exactly. So in terms of risks of trying the vaginal birth after cesarean section, the major risk, and it's not the most common, but it is a major risk that can occur in 1 in 250 women, is that at the point of weakness of the scar, it can tear. We call it uterine rupture. Okay. So it tears, and that means in the process of labor or even before, when it tears, first, the baby is compromised because, of course, the placenta and the uterus are now separate. So the baby is no longer connected to the mom, is not going to have oxygen. Some of them even come into the the abdomen, so into they're out of the uterus basically, and the uterus itself has many big blood vessels that if it tears, you bleed a lot. So basically, the loss of mom and baby is very easy with uterine rupture. So it's a very major risk factor, even though it happens in 1 in 250. So that's one risk. The other risk is just that it could fail. It could fail and someone goes for a cesarean section again, because there's certain medication that we cannot give or that we give with caution when we are, so I know you know maybe about induction of labor, or just giving the drip syntocinon to increase contractions. There's a way that we have to do that with caution so that we are preventing uterine rupture, which means some moms may not, you know, labor the way they would have labored if they did not have a scar. So I'd say that major risk is the one that we really think about, that we really try to work around to monitor when a mom comes in for vaginal birth after cesarean section.
It's interesting because earlier on I was just reading about the whole VBAC and the again the risks and which you talked about, and they said the uterus blood, is that blood vessel, blood supply is like 500 cc on any given day. So imagine if that, that would be a lot of bleeding and a lot of blood loss.
It happens very quickly.
And even for Mary's case, so she said she couldn't dilate beyond 4 centimeters, and so she had to go to cesarean section because initially she wanted to go, you know, through VBAC. And I'm thinking a lot of people would want to actually deliver at home or just go to a nearby clinic because, well, I mean, it's pregnancy and we need to get the baby out, right? How much of a risk is that in itself?
It's because of the risk of uterine rupture that we just prefer that all of this is done in a hospital. In a healthcare facility that has a theater, has access to an anesthetist, has access to a neonatal ICU, even ICU just for an adult, because if that is to happen, unfortunately, 1 in 250 looks small, but if that person is the one and they're laboring at home, things change very quickly. And a mother can lose her life very quickly, and so can the baby. So we advise for vaginal birth after cesarean section for those moms to please just try it in a health facility where there's access to all of these things.
Happens, because also you can imagine the movement from where they are to the hospital. And like you said, sometimes things happen very quickly. And also the whole aspect about, because again, I'm just referring back to Mary's case because we talked to her earlier on, and a lot of people would be like, but why is that a possibility that some people cannot dilate beyond certain, are there like factors, is it genetic?
Not really. I think it's just maybe timing. And in those cases where someone is maybe not dilating for her case, where, you know, she had the scar from before, there are certain things that we can give. There's medication we can give like syntocinon to help the contractions be more, to move things along. But we can't also do it too much in the case if someone has had a scar before. So we are very cautious in such cases and say, okay, you're safer if you have a cesarean section as opposed to us like precipitating or causing uterine rupture.
I see that. And also she said she did not experience any form of labor for all the 5 kids. No labor, no nothing. I'm like, where do you pray when you look at, because no labor, no nothing. So sometimes it's easy to miss that. So healthcare facility is important.
It's very
we have
important.
A lot of people who are choosing home births right now.
I just wouldn't say they're candidates for the vaginal, but I'm sure that there are some who have done it and done it very successfully, and that is good. But as a medic, it's my responsibility to make sure that you are safe and in a safe place, and that if you need access to something, it's done very quickly. Now, maybe in the West, there's access to, you know, ambulances immediately, that the minute you get into hospital, you know, a theater is ready for you in the event. But I mean, looking at Kenya, yes, we're evolving. Yes, there's that, and people are doing home births, and they're able to be rushed immediately, and that's good. But I would say if you have any, you have a high, because if you have vaginal birth after cesarean section, you're considered a high-risk mom. If you're high risk, we just wouldn't feel very comfortable with you laboring at home, where we don't have control over what's going on, and maybe even the monitoring systems are not as advanced as it it would be in the health facility. And so then there'll always be these delays. Even if there are micro delays, there are delays in care. And it wouldn't be fair, so we wouldn't encourage it. We'd encourage if you've had a low-risk pregnancy, then it's fine. Go ahead with the home birth.
Okay, I see that. All right, let's take a break, and then when we come back, remember the question about conversations. When do you start these conversations? What are some of the other factors to look at now from an individual's perspective?
Right.
Because there's some people who will be like, this is what I want, and this is what I want, and that's it.
Yes,
so what are some of these factors that you also need to consider as an individual or as a mom? And then working together with the doctors just to see what's the best outcome. Well, all that is coming up after the break. Just stay with us. Welcome back to the show, and today on Health Diary we're focusing on VBAC, or if you like, vaginal birth after cesarean section. And this is a concern because there's so many people who say once C-section, always C-section. But listen, sometimes this is not entirely true, all right? And we have Dr. Lisa Ochola, who's an obstetrician gynecologist right here at Malaika, to give us all the facts that we need to know. And earlier on, Mary shared her journey of attempted VBAC, but it wasn't as successful, and she had to go through cesarean at the end of the day, right? So the question on what is more preferable, because now I'm thinking it's 2025. We hear a lot of women say, yeah, I'll just go through cesarean and avoid all this other pain and all those things. So what is it that you see mostly that women prefer to go through?
I mean, okay, preference is different, but what is preferred even medically is going through a vaginal delivery because the risks are less. A cesarean section is major surgery. Like we said, you're going through 7 layers, you have to get anesthesia. So you have the anesthesia risks and you have the surgical risks as well, which just means that for a vaginal birth, it's, you know, the risks are definitely less. The healing is, you know, much faster. The ability to, you know, move around is much faster afterwards. That being said, because I've seen that so many women just have that, it's a lot of just having a lot of the unknown, and that's why education is important. These conversations are important so that they know, okay, these are my options. So we ask them, like here at Malaika, okay, why are you scared? What is your fear? And how can we mitigate that? A lot of the time it's like, okay, fear of labor pains. It looks like it's very painful. Here at Malaika, we do birth plans with our moms in their 2nd trimester, where now we discuss that. Which facility do you see yourself going to? How do you want your labor room to be? We discuss what are the possibilities of things happening, including even cesarean section. We encourage our moms to go to visit the partner hospitals and just have a look. So when you feel like you have some sense of control over your delivery, your labor journey, then it becomes a bit easier. Your anxiety is a bit lower. We also have, you know, birth support classes, so like Lamas. So everyone is encouraged generally to, you know, go for Lamas because you're taught how to breathe, you're taught how to, you know, how do you push the baby out, how do you breathe during that time. So all of those things are very important. I think people prefer cesarean section because it's a fear. Anyone would be scared seeing all the videos, hearing about people's stories. But now in this day and age, we do have ways to control that pain. We do have ways for you to labor in a way that you sort of control it. So also not being very rigid and being like, that's all I want to do, but just to be having an open mind and being optimistic and knowing that the outcome is mother and baby being fine.
Very okay. Listen, what do you want in your room? I want flowers, I want all those things. Just kidding. So, and even that, like you say, not to demonize cesarean section. And we have a lot of people who would say, listen, this is what I would have wanted. That is vaginal birth. But there's some factors, some things just happen that you're not able to. Can we talk about things that could happen that might, you know, cause someone to go through cesarean section in as much as they wanted vaginal birth? So we look at the mom's factors and the baby's factors. So for example, looking at the mom's factors, does she have an illness that would, you know, warrant her undergoing a cesarean section as opposed to, or is there, you know, a sudden emergency? So for example, we look at things like eclampsia, which is now after severe preeclampsia, where maybe the mom has had a seizure and we want the baby to come out immediately, or she's gone into some sort of, you know,
cardiac arrest, so she's not even able to try and push out the baby, but the baby needs to come out on time. So there are such things that we may look at, or if the mom's, we've done everything, she has reached this point, but she doesn't have any effort to push out the baby, and maybe we're not able to also facilitate that, and then we say, fine, let's, attempt that, and many other illnesses around there. And if you look at the baby, the most common one is the baby's heartbeat is just, so the baby is not withstanding the whole labor process. And so their heartbeat begins to misbehave and not go, well. And if you see that, then it's a warning sign. Later, they could pass away by the time you're trying to deliver them. So that warrants a cesarean section. Like I said, if the baby's head is not down, and maybe they don't want to attempt, there are certain maneuvers where we can try and make the baby's head down and so on. But if there are breech presentation, or there's something, blocking the path, so maybe very big fibroids at the area of the cervix, there are certain things that we say, okay, this would warrant a cesarean section, and so we prepare you for it.
Okay. So for a case of VBAC, do you allow the mom to carry the baby to term, or you have to do this a little bit earlier, with like them being induced and whatnot?
Yeah. So ideal is that by the time they're reaching term, which is 40 weeks, that you have delivered, so hopefully gone into labor. Or if we do induction, there are certain ways that we can attempt induction for you. Certain things called mechanical induction, where we put in a catheter into the cervix and wait for it to sort of just fall off. It's a safe way. But many people don't want to attempt at late term, 41 weeks, 42 weeks. I mean, the baby is now at this point too big. There's, we can't do much in terms of induction or, helping the labor along. And so we don't encourage it to go past that 40 weeks. Although some facilities and some places do reach 41 weeks and say you can try. So the hope is just that you go into labor at that 40 weeks.
And then at what point do they come to the hospital? Because I know there are others who are like,
let's wait until. Yeah, that's true. I mean, once they're having regular contractions. So it may be regular contractions every 15 minutes, but they have been regular for the whole day. So they're not like the Braxton Hicks contractions, which are, they're stimulated by movement, but then when you lie down or you go to the shower, they've disappeared. That's okay. But if you have regular contractions, you don't need to wait until it's extremely painful or they're 2 minutes apart to start rushing to hospital. You can come in a bit earlier. That's still fine.
All right. And then, so these conversations, when do you start having them? Because again, when I was reading, they said this has to be a very individualized decision, not to be influenced by, say, family or, say, doctors, because you're the one who, the mom in this case, wants to do it. So at what point should they start thinking about this conversation?
Really, ideally from the start. So I have this conversation with my patients from the start, where it's like, okay, you had a scar. What's your interest? You do know that more than 70% of women have attempted vaginal birth after cesarean section and undergone it successfully. This is the risk, because you also have to talk about the risk. You have to talk about that you have to be in a facility where you are being continuously monitored and that there's a chance of, a cesarean section happening in between. So giving women those facts and that education from the beginning also just begins to prepare their minds. And like I said, here at Malaika, we have birth plans. So by the time you're doing the birth plan in your second trimester, we still go through that information again and repeat it again in the third trimester if all is going well. So it's a continuous conversation. And in many places, we do have the forms or a booklet that now you can go through and we keep updating with time. You can change your mind at whatever point. If you decide you want a cesarean section, okay, that's still fine. But the point is just continuous and giving women this information, so not withholding anything from them.
Oh, interesting. All right, so then as we bring this to a close, because I said in a hospital setup is where you would advise women to actually have, their baby, and this is after cesarean section. So what kind of support then is available and is being offered to women who opt for VBAC? And I'll take that as your parting shot.
Good. So, of course, they have their healthcare provider, ideally a consultant obstetrician gynecologist. They have their nurse midwives who will be around with them now, also helping to monitor all through. Not forgetting our birth partners. Doesn't mean it has to be a husband or whoever, but it can be anyone, even an aunt, a neighbor, a friend, just someone who's there with you, who understands this is the process that you're going to go through, so that you also have that emotional and mental support, which is extremely important in these times. I would say that. So for me, parting shot is education. Have this conversation very early. Do not feel like you have to do also VBAC because you feel like you are not a woman because you did a cesarean section. So just do it because you want to do it, but not to prove a point necessarily. And always to have an open mind. Things can change and it's okay. The outcome is mom fine, is baby fine.
Oh, I like that. I really like that. Thank you so much, Dr. Lisa. Dr. Lisa Ochola, who's an obstetrician gynecologist right here at Malaika, giving us all the facts and all the insights as far as VBAC is concerned. Well, time now for you to take a look at this health tip.
Today, we want to talk about the post-anesthesia experience. So after your anesthetic, you would be transferred to the post-anesthesia care unit or the recovery room. And this is an area where the anesthesiologist hands over to the post-anesthesia care unit nurse, and the nurse then monitors you for side effects of the anesthetic and or the surgery, and ensures that you reach a level where you're safe to either be discharged home or transferred back to the ward.
Well, what an insightful conversation we had today on Health Diary as far as VBAC or vaginal birth after cesarean section is concerned. And now, if you had any fears or any concerns, well, they've been answered. But if you still have any other question, our social media handles are down at the bottom of your screen. My name is Winnie Lubembe, and a special thank